So thank you so much for joining us for NAMI Maryland's 40th Annual Conference. My name is Denise Evans, and I'm going to be the moderator for your panel today. This workshop session, Getting the Most Out of Your Health Insurance, How a Consumer Assistance Program Can Help You, will be presented by Ellen Weber, Deborah Steinberg, and Courtney Bergen from the Legal Action Center. Now, you can read more about our amazing presenters, including their full bios, in the digital conference program on our official conference website. Marylanders have an unprecedented need for mental health and substance use disorder care, yet many individuals and families have trouble accessing that care through their health insurance. Some states have established consumer assistance programs to help people understand their insurance coverage for mental health and addiction care, identify providers who will take their insurance, resolve care denials, and file complaints and appeals, and enforce the Parity Act. This session will explore a legislative proposal to create a consumer health access program in Maryland and gather audience inputs and guidance on how that program can help eliminate barriers to care. Now, if this is not the workshop you meant to attend, please click the back button on your browser or click on the Sessions button on the left-hand side of your screen to return to the full list of workshops we have available, and we promise not to hold it against you. We will be addressing questions at the end of this presentation, though I've been told that there will be some polling done during the presentations. But if you have questions as the presentation continues, please post them to the Q&A on the right-hand side of your screen. I'll review the questions as they come in, and I will ask the presenters after they're done and the presentation has been concluded. We're also pleased to offer closed captioning for this year's conference. Captioning is only available for attendees if you're using a desktop. To enable captioning, please click on the quote CC end quote icon below the display of our presenters at the bottom of your screen. Once you click on the icon, the video displays will become smaller and you will see the captions being generated underneath. If you have any comments, concerns, or technical issues, please post them to our chat, and our technical assistant, Aisha, will address them accordingly. So now, welcome, Ellen, Courtney, and Deborah. Over to you, Ellen.
Thanks so much, Denise. It's a real pleasure to be here today. And again, thank you all for attending this session on consumer assistance programs and how they can help you make the most out of your insurance coverage for mental illness and substance use disorder treatment. We have all needed help understanding our insurance coverage, finding providers who are covered under our health plan and are qualified to provide care for us, and getting the services that we're entitled to receive under our insurance coverage. Well, consumer assistance programs can help you achieve those goals and resolve your problems. Next slide, please. So I'd like to talk to you a little and just introduce you to the Legal Action Center and the Maryland Parity Coalition. Deb and I are attorneys with an organization called the Legal Action Center. We're a law and policy organization that fights discrimination, builds health equity, and restores opportunity for people with substance use disorders, mental health conditions, criminal records, and HIV or AIDS. One of the projects that we work on is Parity for All, which is designed to achieve enforcement of the Mental Health Parity and Addiction Equity Act in public and private insurance. And we also work on another large project called the Medicare Addiction Parity Project, which it requires and involves federal advocacy to address discriminatory coverage of substance use disorder and mental health treatment in Medicare. We also in Maryland run the Maryland Parity Coalition, and Courtney is a active and valued member of the Maryland Parity Coalition, in addition to being a budding law student. And NAMI Maryland is also one of our very valued partners in that coalition. And what our goal of the coalition is to advance equitable access to mental health and substance use disorder care, and to end insurance discrimination against people with mental illness and substance use disorders through our organizing, through advocacy, and education. And NAMI Maryland has you're probably a little familiar with what we're going to be talking about today, because over the last week or so, NAMI Maryland has shared a survey with you that asks for your input on a consumer health access program. That is a consumer access program that we are trying to establish in Maryland. And as Denise has said, throughout this presentation, we're going to be doing some polling to ensure the most active and interactive presentation that we can. Courtney will have some very specific questions for you. And as Denise said, whenever you have any questions, please just pop those into the Q&A. So for over the next hour, what our goal is really to describe consumer assistance programs, to get your input on how such programs can assist you and your loved ones in accessing the mental health and substance use services that you need, and then discuss our advocacy to create this CHAP program, the Consumer Health Access Program. Next slide, please. So before we get started, we really just want to find out who's here today. And so we have popped in there a poll. If you could go to the poll function, you'll see, we hope, some options for identifying who's sort of in the audience today. Well, I don't see a poll there. What we wanted to ask folks is to identify whether you are an individual with a mental illness or substance use disorder, a family member or a friend of an individual with a mental illness or substance use disorder, whether you're a healthcare provider, whether you have some other interest, or more than one of these individuals. So I don't see the poll. I'm not sure if anybody else does.
Maybe people can put the answer in the chat, since I don't think there's a ton of people.
That would be great.
The survey is in the chat. Where's the poll? Oh, there's the poll. I don't know how they respond.
Do you see the poll, Denise?
It's not in the poll. If I click on polls, I don't see it there. I do see the questions on your screen.
Right.
Aisha, can you start the poll?
So since I'm sharing the slides, I wouldn't be able to, but I believe it would just be best to answer it in the chat.
Okay. So just give folks a minute or so to do that. I see from the participants that one other person that's actually here today is Laura Mitchell, who is another really active member of our Parity Coalition. So it's great. It's great to see you today, Laura. And great. Thank you for identifying your interest. Perfect. So terrific. We will hopefully be able to provide all of you with some important information that will help you both as an individual or as a family member of an individual who needs these services to better access them. Next slide, please. So what I wanted to start today is just to talk a little bit about what a consumer assistance program is. Some of you may already be familiar with these, but essentially what they are organizations, an entity that provides help to healthcare consumers who have questions about choosing health insurance or accessing their benefits. The goal really of all consumer assistance programs is to make the healthcare system less overwhelming and more affordable for consumers. There are generally 5 activities that when you look at model programs, and even some federal legislation that provided funding for consumer assistance programs when the Affordable Care Act was enacted, there are essentially 5 different activities, and they have a dual purpose. One is to help an individual who needs access to insurance or resolving problems, but also to promote system-wide improvement. So those activities involve education, to inform individuals and help improve health literacy about health insurance and consumer rights and responsibilities. It's to provide assistance for health plan enrollment and renewal. It's also to assist with navigating coverage for mental illness and substance use care and the benefits of that coverage. It is to assist, directly providing assistance to file complaints and challenge denials when someone faces an insurance barrier by your health plan. And then finally, it's to gather data and report back to policymakers about system-wide problems that exist that have been identified through all of the education and client assistance efforts, and then to propose solutions to those system-wide problems. So as you can tell, the goal is to help an individual consumer, but then to ensure that there is system change so that individuals don't have to experience those same problems over and over again. So those are the dual goals of a consumer assistance program. The one other thing for us to keep in mind is all of these activities, though, are provided in collaboration with other organizations that already exist in the state. That might be consumer-based organizations or other state-based activities. And not to recreate the wheel, but to really fill in gaps, supplement those activities for individuals where they exist, and really to coordinate assistance across all the different systems that already exist. As one of our partners in the Parity Coalition has often said, it's not that there aren't services that exist in Maryland. It's just you don't know where to start, and you don't know which one is going to provide the right assistance to you. And certainly there isn't somebody that does all of that coordination. And that's the goal of a consumer assistance program. Next slide, please. So why is there a particular value for consumer assistance programs for individuals with mental illness and substance use disorders? And again, a consumer assistance program can help the entire public, regardless of what health condition you have. In Maryland, what we're trying to do is establish a very specific program to help people with mental illness and substance use disorders. And there's a real reason for that to happen. First of all, we all know that there is a significant need for mental health and addiction treatment in Maryland. Here is just some of the data from the most recent National Survey for Health and National Survey for Drug Use and Health. It documents just such a large number of individuals in Maryland who have a mental illness or a substance use disorder. It identifies sort of the number of Maryland youth who have depression or who have a substance use disorder. We all know that Maryland has an incredibly high rate of overdose deaths. It's the sixth highest rate in the country. And Black Marylanders die of opioid overdose at a disparate rate compared to white Marylanders. So there is this significant need for mental health and substance use disorder treatment. But we also know that access to treatment is very limited. In Maryland, nearly 25% of young adults ages 18 to 25 who need treatment for a substance use disorder didn't receive that care in a specialty treatment in 2020. As of February 2021, 39% of adults, nearly 40% of adults in Maryland reported symptoms of anxiety or depression, and 31% were unable to get care. And this is NAMI statistics that have brought all of this to light. There are over 1 million Marylanders who live in communities that don't have enough mental health professionals. And interestingly and critically, Marylanders are more than 10% more likely to have to go out of network for outpatient mental health or substance use disorder care than primary care. All of this data reflects the lack of access to services, the limited availability of services in carrier networks. And those are all the kinds of system-wide barriers that consumer assistance programs can identify and can assist both on an individual level and on a system-wide level. Next slide, please. The other thing we also know in terms of when you're actually trying to get access to these services is that insurance is very complicated. And historically, insurance, regardless whether it's public insurance or private insurance, has discriminated against individuals with mental illness and substance use disorders. Very often, plans provide less access to services, fewer benefits are more expensive, and it's harder to find providers who deliver those services. And so in the midst of a crisis, coverage is very confusing. And the confusion often results in individuals avoiding or foregoing care only to get have more chronic conditions. There's also a lack of accurate information when you begin to seek out where to find care and what your insurance covers. And the system is really difficult to navigate at the time of a healthcare crisis. So outside support, which is what a consumer assistance program offers, helps one break through all of that complicated features and ensures that somebody is able to get access to the care that they need. And in addition, consumers may not know that they actually have a right to equal mental health and substance use disorder benefits. We all are very familiar with the Mental Health Parity and Addiction Equity Act, but many do not know how to exercise those rights and don't know that that means really equal coverage of mental illness and substance use services, equal reimbursement rates, equal access to the range of providers who deliver that care, and should not be subject to more burdensome rules for accessing care. So those are the kinds of rights that, again, people who have some expertise in this, who staff a consumer assistance program for people with mental illness and substance use disorders, they can bring that knowledge to bear to help individuals get the care that they need and are entitled to receive. Next slide, please.
All right, so I think I created a poll. Let me just publish it and let's see if this works. All right, so the first thing we want to know is what type of insurance do you have? A lot of the times, what rights you have with your insurance and how you access care depends on your insurance. So having this information just helps us talk about this more effectively. So the options are Medicare, Medicaid, employer plan. So if you get your insurance through your workplace, a federal or state employee plan. So if you work for the government in some way, veterans coverage, that might be TRICARE or another insurer for people in the military. Some sort of other coverage. There's lots of different types out there. I think I left out ACA plans. So you can put that in other coverage. And then not sure. I know when I started off this work, I didn't know the difference between all of these. And then not insured. So if you might not have insurance. So I will do show results. So it looks like most people here have employer plans. So that's good because they're usually subject to the Parity Act.
We also have a few people posting in the chat what plans they have, and that's great too. Whatever is easiest for you.
And then, oh yeah, so student health insurance looks like someone has, which is state regulated, and then usually, and state plans. Great. Should we go to the next slide?
Thanks, Courtney. So there are a number of very common barriers to accessing mental health and substance use disorder benefits under insurance. And probably you've experienced some of these, which we're going to poll for in a minute. But generally, just as Courtney mentioned, sometimes we don't even know what type of insurance we have. Very often, though, we also don't know what mental illness and substance use disorder services are actually covered under our insurance. Very often, the plans are very unclear in terms of their description, so there's a real lack of transparency. And again, the benefits themselves are complex. And the information about health insurance coverage may not even be accessible to individuals who are trying to get an answer to their questions. We all know about the provider network barriers, right? Very often, the provider directories, which is very often the first place we're told to go in order to find a provider who is actually in our network. They're incorrect or they have inaccurate information. Often they don't list all the providers, and sometimes the providers who are listed are not part of that network. Often we can't find a provider who actually can treat the condition that we have, the diagnosis that we have, or may not be able to treat a child, an adolescent, or any other number of conditions. Often we can't find an individual who is culturally appropriate in our community, who can identify with us regardless whether it's related to gender or race or gender identity. Often though, even if you find a provider, there's a long wait. And very often when individuals have to go out of network, there are high or unaffordable out-of-pocket costs in order to get the promptest care needed. So that's a huge set of problems. Again, these are kinds of problems that the Consumer Access Program can assist people with. There are also access to healthcare. Once you find a provider, very often the carrier or the health plan that you have won't authorize or approve the care that is provided or recommended by your practitioner. Or they may ask you to get approval for that care on a very frequent basis, which isn't consistent with the way your treatment is going to progress. There may be a long wait to get approval, and the care is often denied or limited once you find the practitioner and they provide the right diagnosis. And then finally, there are often just no help. There's no help or assistance in navigating those barriers. Very often individuals have very stigmatizing views against people with mental illness and substance use disorders, and therefore they don't really understand and assist us in the way that is most helpful. Very often resources aren't accessible, and very often there's just simply not being responsive in a time of crisis or recognizing what the lack of responsiveness does to a patient who needs immediate access for mental health or substance use disorder care. So we would suspect that some of us or all of us have experienced some or more of these problems, and we want to poll you a little bit about that. Next slide, please. Courtney, can you come in on that one?
It is not letting me publish that one. So if maybe people are responses in the chat, that would be great. So if you just want to let us know what type of barriers you have experienced accessing mental health or substance use disorder care. And I'm sure there's, you might have experienced many of these. So if you just want to let us know maybe what's the biggest barrier, or if you are able to write out a few, that would be great, just so we have an idea. So whether it's, you just don't understand your insurance benefits, provider directory, you go to call a provider and there's just like listed in your insurance plan and there's no one in network. There's no providers for your treatment needs. If you've had to pay out of pocket in order to access care, or had to get an authorization from your insurance before accessing care. Yeah, providers not accepting Medicare is a huge one. In the inaccurate directories. Yeah, and very few take insurance. That is a very common one in Maryland. And high deductibles, that's another big one. All right, that's helpful to know where to start. Thank you. So why don't we go to the next slide? And if there's other ones you want to put in the chat, feel free to keep adding. I know there's a lot.
Thanks, Courtney. And so, as we said before, there's no question that Maryland has a number of resources to help people access care and navigate their insurance. Whether they are available and accessible to you is another question, but we want to identify what some of those resources are, because as I mentioned, the Consumer Assistance Program works in coordination with existing resources, trying to fill in gaps and supplement what already exists. And so here are just a few in the kind of basic categories of activities that consumer assistance programs engage in. So we have in Maryland some helplines to identify and link individuals to treatment. There's 211 Maryland. The Black Mental Health Alliance has a very active provider locator service. Maryland Psychiatric Society has a service to help identify and locate psychiatrists. There are crisis response activities that most county health departments offer. And as we all know, under the Affordable Care Act, the state created connector entities or navigators, which are the entities that help people enroll in marketplace insurance plans, whether that's Medicaid or private health plans or individual plans. There are also organizations that help do some care coordination for either specific mental health and substance use disorder needs or broader healthcare needs. Two that we've identified are the Maryland Coalition of Families and the Prince George's Healthcare Alliance. And then finally, there are state agencies that are available and have as their job consumer education and individual assistance. The first one that we've identified here is the Health Education Advocacy Unit. This is a unit within the Attorney General's office in their Consumer Protection Division that provides education on private insurance and assistance in resolving private insurance complaints. Not Medicaid or Medicare, which they will provide referral to, but this is for private insurance. This is an entity that helps mediate problems and helps individuals resolve those directly with their carrier. The Maryland Insurance Administration, which is the agency in Maryland that regulates private insurance, provides insurance education, and they are the entity that resolves complaints. They are actually the place where a consumer would file a complaint, and it is the Maryland Insurance Administration that resolves that dispute. Maryland Medicaid also has an Office of Constituent Services and Customer Service Center. It's an online service. And then for individuals with Medicare benefits, the State Health Insurance Program, or SHIP, will help give you some guidance on Medicare benefits, how to address bills, and what your rights are. For any of these entities, we have links in these slides when you receive them. You can click on those links and you can find out more about any of those organizations. And I mentioned there are others in the state, but these are just some examples of the kind of entities that already exist. Next slide, please.
All right, so the polls are protesting me, so I am going to read this one out loud too. So we want to get a sense of which resources you've used to access mental health and substance use disorder kind of insurance questions, if you've accessed any of these. So if you've accessed any of the resource helplines, such as 211, County Health Department Crisis Services, if you've sought help from the Maryland Health Connection or Medicaid enrollment, the Maryland Insurance Administration. So that might be if you've ever filed a complaint or sought help filing an appeal with your insurance. The Health Education and Advocacy Unit, that's as Ellen said it, Attorney General's office, service, Medicaid constituent services, or the state health insurance program. So I'm seeing none from one person. Has anyone else used any of these? Let's see. 988 healthcare access. All right. So I think we can move on to the next slide, and feel free to keep putting answers in the chat. If you have used any of these resources, we'd love to know if you've used them.
Thanks, Courtney. Next slide, please. So let me start talking just a few minutes about CHAP, and then we will move on quickly to other pieces so that we could get more input from you. But the Consumer Health Access Program, or CHAP, that we have, the Maryland Parity Coalition, has attempted to develop through legislation in the last General Assembly session, and will come back for a second effort at it, really provides and would provide the full range of activities that model consumer assistance programs provide. They would do outreach and education, both in person and virtually, both again to improve health literacy relating to insurance benefits for mental health and substance use coverage, regardless of the type of insurance. So regardless of whether you have any of the insurance, the types of insurance plans that Courtney identified, whether that's Medicaid, Medicare, an ACA plan, a veterans plan, an employer plan, that the CHAP program would be able to provide education around that. And it would talk about benefit coverage, available services, and how you access treatment, how you enroll in those health plans, and what your rights are under the Parity Act. It would also operate a toll-free helpline, an online assistance portal. It would directly assist consumers, providers, and crisis responders in resolving insurance barriers, whether that's informally or through more formal representation. And again, it would be the range of problems that we've already talked about: enrollment problems, service coverage, identifying providers. All of those various issues would be ones in which CHAP would be able to assist a consumer or a provider in resolving. For those that can't be resolved, for problems that can't be resolved informally, CHAP would also assist and actually represent consumers in filing complaints, grievances, and appeals. And then lastly, to address that system-wide reform component of consumer assistance programs, CHAP would collect and analyze the data that comes out of all of its client interactions and all of its education efforts to really identify where the system-wide barriers are in coverage and access, and then would recommend improvements to policymakers to try to fix those problems. Next slide, please. And taking one more minute just to give you a slightly better idea as to how the CHAP program is structured and how it would operate. Again, as I mentioned, this would be a one-stop shop to help individuals resolve problems directly or link those individuals to the organization that can. And that would be a direct link to somebody who can assist, rather than giving the consumer a laundry list of telephone numbers and leaving them to their own to try to find the right person. CHAP would be staffed by individuals with mental health and substance use disorder lived experience, and those who represent the racial, ethnic, and gender diversity of Marylanders. And the goal of this is, again, to provide culturally appropriate assistance and to reduce the stigma that we know exists and that is a barrier to individuals getting the care that they need. It would, again, as I mentioned, help individuals regardless of the insurance type. It would provide direct client representation to challenge service denials. And as I mentioned, it's going to work with state agencies and policymakers to resolve those system-wide problems. On the right side of your slide, you'll see sort of a schematic in terms of how this consumer health access program will try to achieve that. And what you see is there is a hub entity, which is a non-governmental organization, nonprofit organization in Maryland, or a university, that really has as its job sort of creating this program and honchoing it. What it would do is it would contract with 8 different entities across the state. We call these spoke entities. And these 8 entities are in the regions that have already been designated by the state as those connector entities for private insurance, Medicaid enrollment under the Affordable Care Act. So it's these 8 organizations that would be around the state, would be trusted organizations within communities that would provide much of the education and outreach and on-the-ground assistance. But you see a two-way arrow that goes between the spokes and the hub, because this is a system in which a person can come into the CHAP program and gain assistance in whichever way is most appropriate, whether they come in through the community, whether they come in through that central helpline portal, which whoever is contacted will assist that individual. The hub will also contract with some specialty organizations, community-based organizations who may have expertise in the particular needs of clients, whether that's a Medicare population or others. And it will provide technical assistance and quality assurance to ensure that everybody is going to be delivering appropriate services. If you see at the bottom, there's an arrow to state agencies and policymakers. And again, as we mentioned, there are probably existing entities that are run by the state that actually provide services. If there's an entity that does that, either the spoke or the hub entity can do referrals to that individual or that organization, as long as there's somebody on the other end who can actually help the person solve the problem. But again, if the hub and the spoke entities are going to do direct client representation, they very well may be working with the Maryland Insurance Administration or Maryland Medicaid to actually get that person's problem resolved. And of course, they would be doing direct work with the carriers. One more component, as I said, they're going to be communicating with policymakers so that they can resolve some problems that are system-wide problems. And then finally, there's an advisory council, and that advisory council would be composed of all of the state entities that are already engaged in these kinds of consumer assistance activities to ensure coordination and to ensure accountability. It would also include consumers, peers, providers, others with lived experience, so that the goal of that advisory council is to identify and help with the design and improvement of the CHAP program, to identify and review the data that they're collecting, and to make recommendations to improve the services that are going to be delivered. So I'm happy to answer other questions after during the Q&A period about this. Next slide, please.
All right, so we wanted to give some examples about how CHAP might work with some common barriers that we know people experience with their insurance. So the first one is, my insurance is denying coverage for my antipsychotic medication. I can't afford my medication. Can CHAP help? And the answer is yes, CHAP would be able to help in various ways. So the first thing is we would try to get more information about what's going on. So CHAP would investigate the plan's drug formulary and determine which medications are covered and why the medication might be excluded. If there's any prior authorization requirements, so it might be that your doctor has to submit additional information to the plan, and whether the plan is violating the law. So whether it's violating the Parity Act or other Affordable Care Act requirements or any other regulations. We would then contact the health plan and advocate for approval of your medication and removal of coverage limitations and authorization requirements. If that didn't work, CHAP might file a complaint to appeal the denial and include Parity Act or federal law violations that might be implicated. And then the immediately things would be getting you the medication that you're trying to get and navigating those insurance barriers. But the other important thing about CHAP would be using the information with obviously your consent, whoever's issue this is consent, to inform state and federal regulator kind of advocacy efforts and inform them about barriers people are experiencing to getting their mental health medications, and then advocating for removal of these authorization requirements kind of on a broader scale so that other people aren't facing these barriers and that you're not facing these barriers again in the future. So, next slide.
So a second example is one that is very common. This is a situation where a family member basically is saying that their 21-year-old son has received substance use disorder treatment in a residential treatment program for 2 weeks, but the state-regulated health plan is now denying continuing care, which has been recommended by the addiction specialist. This family member doesn't know how to stop his discharge or to find a suitable outpatient program for him. So can CHAP help on this problem? Again, yes. And what CHAP would be doing would be, the goal really in this representation is to try to make sure that this individual that the son has access to the right care, be able to continue in treatment, and then to be able to plan for future, for aftercare, after son is discharged eventually. So again, what would happen here is CHAP would contact the plan, try to resolve it informally, but file a grievance seeking really expedited review, challenging the discharge, and raising, again, possible parity violations. Expecting that the plan may not change its decision, it would also prepare an emergency appeal to the Maryland Insurance Administration to be able to immediately resolve the problem so that there is no discontinuation of care. While doing that, CHAP would consult with the patient's provider about perhaps the right level of care in outpatient services that would be needed next, whether that's a partial hospitalization program, whether that's an intensive outpatient program, and then would look at the plan network to see whether or not they're providers of those services. And if there are not providers who can deliver the service in a reasonable time or within a reasonable distance of where the patient lives, they would know that there's a law on the books that allows that individual to seek approval to go to a non-network provider and not pay high out-of-pocket costs based on that inadequate network. And so what you see here is this consumer assistance program brings its knowledge of insurance law, it brings its knowledge of appeals, and its advocacy on behalf of people with substance use disorders and mental illness to try to achieve those rights. And then finally, as in the previous problem, it would report this plan to the Maryland Insurance Administration if there are network adequacy problems, and certainly if there are Parity Act violations. And some of those Parity Act violations may include requiring this individual to jump through more hoops than if they had a medical problem, as well as treating the chronic substance use disorder as an acute care condition, as opposed to treating it as a chronic condition and therefore cutting short the more intensive level of service that's needed. Those are all potential parity violations that really need to be brought to the attention of the plan as well as regulators. Next slide, please.
So here's an example. I'm enrolled in a Medicare Advantage plan and my doctor says I need more intensive care for my alcohol use and depression. I would like to go back to the community program that provided treatment under my employer's plan. My Medicare Advantage plan says it doesn't cover that treatment or that type of program. Can CHAP help me? The answer again, yes. CHAP would help provide education about the scope of substance use disorder and mental health benefit coverage under Medicare Advantage plans. Unfortunately, as someone noted in the chat, Medicare coverage isn't great for either substance use disorder or mental health benefit coverage. So one of the other things CHAP would do is help investigate whether you're eligible for any other coverage that would supplement your Medicare Advantage plan, and whether you're willing to change to traditional Medicare, because sometimes traditional Medicare is actually a little bit better for mental health and substance use disorder coverage than Medicare Advantage. And you can do that during the next open enrollment period, which for anyone paying attention is starting today for Medicare. It would also ask your primary care provider to deliver and bill for more intensive coordinated care that is covered under Medicare while you investigate alternative payment options. There are some codes and different things that are available that a lot of providers don't know about. So there's some education that CHAP can also do for providers. And CHAP would also contact state authorities to request funding for SUD treatment that is not covered by Medicare Advantage plans, because in Maryland, the state will help cover treatment when your insurance is not sufficient. Next slide, please.
All right, so we have some questions. I know that many people said they did not use Maryland's existing resources, but if you have, were you able to get the help you needed to kind of navigate the insurance barriers to care? And why or why not? So please feel free to put that in the chat. The other question, because I know many have not used the existing services, because I know I personally didn't know they even existed before getting involved in the Parity Coalition. What barriers are you facing in accessing mental health and substance use disorder care? And specifically, if those are insurance barriers, we'd love to know about those. Let's see. Any answers yet? Okay, and then we also, in kind of designing this program and advocating for it on legislative level, we want to know what type of assistance would be most helpful to you. So if I'm trying to think of something very specific, someone really walking you through that process, one step at a time, being able to connect you to services. Kind of do you have ideas on how that could be most helpful, what you might need? And then if you were creating CHAP, what would that program look like? And it doesn't have to be completely realistic. Like it can kind of be your dream world. What would you ideally like from a program like CHAP? So please feel free to put your answers in the chat. I'm not seeing any yet. So let me see. In terms of, I'll just give an example of something I would really like to see while I'm waiting to see if anyone else wants to put an answer in the chat. But something I would really like to see is kind of a one-stop shop that can help you with multiple insurance plans. I know some people might have Medicare and Medicaid. Someone might have, Medicare, Medicaid, private insurance, or some combination. So I think a one-stop shop that can deal with all those would be great. Someone said the main barrier is the lack of mental health providers that accept Medicare. That's a huge one. I think, I'm not sure exactly, Ellen might be able to speak to more to how CHAP might be able to deal with that. But I think on an advocacy level, CHAP would be able to help with that significantly, just even by getting that information. And any other thoughts you might have about how CHAP could benefit you or your loved ones, your family, friends, just navigating mental health and substance use disorder care. We would love to get your feedback. An urgent care program that takes anyone regardless of insurance. I think coverage for that would be a huge thing that CHAP could advocate for and is something that's definitely needed. So please feel free to keep adding answers to these into the chat. And why don't we move on to the next slide?
So we want to also share basically the opportunity for you to help us get CHAP over the finish line, to make CHAP a reality. So by way of background, this was a bill that was introduced in the Maryland General Assembly this past year. Senator Malcolm Augustine and Delegate Robin Lewis introduced the CHAP bill this past winter. The Maryland legislative session is short. It's just from January to April. But during that time, we were able to see the bill pass the Senate, a lot of which was thanks to all of your advocacy and Senator Augustine really working on this and talking about how important it is. We even got the governor to allocate some supplemental funding for CHAP to get it started. However, the bill did not pass in the House. The bill was sent out to one of the committees and it stayed there. It did not pass out of the committee. So one of the instructions from the House was to have the Maryland Insurance Administration, the MIA, convene a work group during the interim, so the time between last session and this next coming session, to address some outstanding issues that some people had raised with the bill. Next slide, please. So the work group is still happening. There's actually a meeting coming up. And one of the things we really need to do right now is make sure the work group members understand the need for CHAP. We want them to see how important this is and how it will benefit all of you and all of us. So now is the time to share your story with NAMI and with the policymakers on the CHAP work group. We have a QR code to the survey that NAMI has created and also the link on this slide. So you can scan your phone over that QR code, or I think the link is already in the chat, but we'll put it in again if you haven't seen it already. But generally, we want to know, what barriers have you and your loved ones faced when trying to access mental health or substance use disorder treatment? We've asked this a little bit in the chat, so it would be repetitive, but it's because you're not telling us. It's because you're telling the policymakers. What happened as a result of those barriers? Did you have to delay treatment? Did you forgo treatment altogether? Even sometimes worse things happen. We know that people die because they don't get the treatment they need. They end up in jail, and these issues disproportionately happen to Black and Brown Marylanders. So what support do you wish you had, either then or now? What would have changed that outcome or made it easier for you to get the care you or your loved ones needed? These are the things that the MIA work group members need to hear for them to be able to advance this legislation and get it over the finish line. Thank you, Courtney, for sharing the survey link in the chat. Next slide, please. And so one other legislative opportunity, in addition to doing some informal education, the bill is going to be introduced again this coming session. So, this next January to April Maryland General Assembly session. So you can help this bill become a law by joining NAMI's advocacy. You can share your story more formally with legislators by providing testimony when the bill comes up before a hearing. And that can be written, you can write your story, and it can be short. It can be a paragraph or a page, or you can testify orally in front of the committee. You can also attend meetings with individual Maryland legislators, or you can contact your representatives directly to share your story. And you can help us by posting about CHAP on social media to help spread the word. One of the resources we'll be providing are some sample social media posts that you can use to help get the word out. And that will help us spread the word to other Marylanders. And you can also tag your representatives to get their attention in a way that best suits your needs. Next slide, please. So mindful of time, if folks have questions, please share them in the chat. And if we can't answer them all out loud, then we will answer them in the chat or make sure to follow up with you after.
Hey, Deborah, you do have a question. If you click on the Q&A tab.
Oh, wonderful.
There's a question there.
Thank you. If my insurance company says the allowed charge for an outpatient mental health visit is a fraction of the market charge, is there a way to appeal? This is a great question for Ellen. Ellen, would you like to take this one?
Sure. What this raises, just from what you've described, is probably a Parity Act violation, right? So what one would do would be to take a look at how the medical benefits are covered. And if the medical benefits are covered at a higher fraction or a higher percentage than mental health and substance use benefits, that could be a parity violation. And so that's something that would be reported to the regulator of that health plan for further investigation. And you'd file also a complaint with the plan itself. So that's one very common problem. It's also something that CHAP can help with by just trying to get a better idea as to how they set the rates and what you would be reimbursed at. So again, it's a real way of gathering the information, learning more about how plans set rates. Reimbursement rate setting is a huge problem, and it's also one that federal regulators are interested in resolving, because we know it's one of the key reasons that people don't get access to services, one of the reasons that networks are not adequate, and then one of the reasons that individuals have to pay out of pocket if they need to get care promptly.
We have another great question in the chat, or it wasn't phrased as a question, but I will turn it into a question. Mental health parity is still limited for private insurance. How do we get to true parity? It seems that the best mental health insurance is Medicaid insurance, which provides a large array of mental health treatment options. Great point. Parity also applies to a lot of Medicaid plans. So parity applies to Medicaid managed care plans. That's when you have a private insurer managing all of your Medicaid benefits. It also applies to CHIP plans, and it applies to the Medicaid expansion population. It's not everyone, though, and parity doesn't apply to Medicare or the Veterans Administration benefits. So we do have a lot of work to do, but that is an area where CHAP can help advocate. So this is another one of those times where large-scale advocacy is needed, and CHAP can use the stories it is getting and the lived experiences to help make a difference for the lives of all Marylanders. But for folks who are coming in with one of these Medicaid plans where there are parity violations, that's an important time for CHAP to be advocating that these are parity violations. It's not just to the MIA, it's also to the Maryland Department of Health and the Maryland Behavioral Health Administration if these Medicaid managed care plans, CHIP, or the expansion population is not getting the care they need because their plans are violating the Parity Act. So keep posting your questions, and we'll just move on to the next slide. So here are some resources. I'm not sure if they were already shared with folks, but we'll make sure they're available afterwards. We have some fact sheets about CHAP that we developed for this past session, as well as testimony from NAMI that was delivered to the policymakers. We also have this infographic that you can see in small print on this screen, but that will be available to you as well. And there's a report that was developed by the Community Service Society and Community Catalyst, two organizations from other states, about consumer assistance programs. So you have a sense of how these work effectively in other states and why Marylanders deserve that same support and assistance as well. Next slide, please. All right, so here's our contact information. Again, Ellen Weber and myself, Deb Steinberg at the Legal Action Center, and Courtney Bergen, law student at University of Maryland. So we're, I think, going to hand it back over to Denise. Thank you.
And thank you, ladies, for that excellent presentation. And I'll ask a quick question. It's not a question, it's just a situation that I'm assuming CHAP would handle. I had a situation where my daughter was out of state in college and she had a psychotic break, and I didn't even know she had mental health assistance. You can't imagine the confusion of jumping on a plane and getting there and not having any idea how anything works. However, the medical facility, the head of the medical facility on her campus helped me navigate everything. But I'm thinking about the reverse. Somebody's out of state. There are lots of universities in Maryland. How would you, I'm sure they could call CHAP, but how will you publicize it so that it gets broadly known that when this resource is available and that an unwitting parent from out of town could find it? I mean, it's kind of a crazy question, but I lived that situation and it wasn't pretty.
I mean, that's a wonderful question, and I'm glad that you were able to get the assistance that you needed in that real time of crisis. And that's exactly why we need to publicize organizations like CHAP. It would just be broadly disseminated. And one of the reasons you have a hub and spoke model is because those spokes are in the community. They know they are trusted in the community, and that's a tremendous way to get education out. We would be collaborating with state agencies as well for information to be circulated and identified. And so we would use sort of all of the avenues. And I mean, again, we don't want CHAP to be just one more number that gets called. We want people to understand that it is a good number for for coordination and resolution of problems that unfortunately, is not always available when you call the various numbers that you're given.
No, it's a critical resource. So I'm glad you guys are working on this. Courtney?
Just to follow up on what Ellen said, one of the things I think that's really critical about CHAP is working with providers so that mental health providers know about it, and then also working with college campuses too, and making sure everybody kind of has insight about it being available. Because I experienced that situation too.
Courtney, you're breaking up. We have 1 minute left, but there was a quick question here. How do we bridge our gap for people who have a $6,000 deductible and are unable to access their insurance for mental health care? In 30 seconds.
Yes, for me, that would be a good time to talk to CHAP about your different insurance plan options. Because if you need regular mental health treatment and you're paying for a high deductible plan, that a high deductible plan might not be the right option for you. So CHAP would be able to walk you through the different plans that are available to you. If there's any supplemental coverage, because it sounds like a $6,000 deductible is not affordable. If there are other low-cost providers in your area, maybe your insurance offers different options. So it's worth looking into with an expert if it might be a higher premium, but there might be premium assistance. So there are just lots more options of plans. But it sounds like if that's the only option available to you, that's cost prohibitive. So that might be something where advocacy is needed at a broader level to make sure that you do have access to plans that are affordable. And again, CHOP could help you with that individual assistance or with that broader scale advocacy.
So Ellen, Deborah, and Courtney, thank you so much for such an informative session. If you ladies have, if the audience has further questions, you can get the questions to them by saying the name of the session and the date, and send your question to connection@namimaryland.org. And they will, you can also add your questions to the end of event evaluation later this afternoon, and they'll get those answered by the ladies here. So this is all the time we have now. Thank you for joining us today. You'll receive a link for an evaluation survey at the end of the session, at the end of the conference. And if you'd like to acquire CEUs for this workshop, submit your responses no later than Saturday, October 22nd. The next workshop begins at 2:20. Thank you so much.
Thanks very much, everyone.
So I think it's just the 5 of us. I think we're off. Thank you. This is such a needed service. Oh my gracious.
Yeah, we're really excited to be working with NAMI on this. NAMI was amazing over the last legislative session in terms of really pushing this and moving this along and getting support from the governor's office. We were all really disappointed when the bill didn't get through. We thought it would. But we're at it again. And I think it would take some, obviously it takes a lot of work to stand it up, but we think it really would be very valuable.
Well, I hope we have better luck this year. Actually, we have a new advocacy person. Maura has left, and Pete Garagiola is one of the speakers during the conference, if you get a chance to meet him then, if you haven't already. So.
Yeah, we've worked with him. We're working mostly with Morgan so far, but no, Mr. Garagiola, when he was serving in the Senate, had some contact then. But I'm glad that we really love working with Maura, but I know her partners are going to be just as good.
Oh, yeah. She's great.
Yeah, she's terrific.
Well, you ladies have a great day. It's good.
Thanks so much. Nice meeting you.